I wanted to end the discussions about different types of melanoma with the kind of melanoma called uveal melanoma. Uveal melanoma is the kind of melanoma that arises from the back of the eye. And one of the challenges about uveal melanoma is that for a long time, these immune therapy drugs that I've been discussing with you did not recognize uveal melanoma as foreign. And so uveal melanoma cells could continue to grow and divide, and it was not appreciated that the uveal melanoma cells were foreign to the body. So these standard immune therapy drugs like nivolumab, pembrolizumab, ipilimumab, and relatlimab were ineffective for the most part in most patients with uveal melanoma, although a subgroup of people can have a nice benefit. And one of the new ways of treating the patients with uveal melanoma has come forward recently, and it helps bring T cells into the tumor microenvironment such that the immune response can be enhanced against uveal melanoma cells and then ultimately seek and destroy these uveal melanoma cells. And the way that's done is through, this is a picture of uveal melanoma here on the left in the back of somebody's eye. But the way that that's done here is through a new drug that's gotten FDA approval called Tibetophus. And what happens with Tibetophus is that a special kind of antibody called a bispecific antibody grabs the T cell with one hand and grabs a melanoma cell with another hand, and it just brings the T cells close to the melanoma cells. So it essentially is like a matchmaker. It grabs the T cell, says, get over here to the melanoma, and I want you to see this melanoma cell that shouldn't be here. And that's a way that uveal melanoma that traditionally hasn't been as successfully treated with kinds of immune therapy drugs like we were discussing is now starting to be successfully treated with this drug called Tibetophus. But only certain types of patients with uveal melanomas are candidates for that, and it depends on the HLA status of an individual patient's immune system. But it's very important if you have uveal melanoma that started in the back of the eye, as might be shown in this example picture on the left. This is the retina where the nerves and the optic nerve exist, and a big kind of black uveal melanoma that's present there. If that's the kind of melanoma you have, it's really important to make sure that you've done appropriate HLA typing to help determine if you're a candidate for this, what I call a matchmaker type drug of Tibetophus, to bring the T cells closer into the tumor microenvironment. And this is the notice that the FDA approved Tibetophus earlier in 2022. First time, actually, there was an approval in advanced uveal melanoma. So really a great outcome for patients.